Many people ask me, what is my policy on revision? Well, I tell people, surgery is not an exact science, and so even with the best of intentions and wills, sometimes things don't go according to plan. Thankfully, it's a very, very small percentage of patients. What I generally do with all my patients is obviously we do the procedure, we then follow them up for a number of times in the post-operative period up to about 1 year, because as many people understand, it does take time to see the final result of any operation, regardless of where this is performed, whether it's on the face, the body, the chest. And so there's a journey, a healing time, scar tissue develops, some time for settlement, and all that takes time. And I say to people, that can take anywhere between 9 to 12 months or even a bit longer. And so throughout that journey or time period, we will see patients 3 to 4 times to make sure everything's going according to plan, give them appropriate advice, which may help with the outcome of the result. So once we've done that and we've been through that journey and we get to the final point, a year or so later, we then sort of see patients again for a final checkup to make sure that they are happy with everything and the outcome is what they expected. And the good news is the vast majority of people are overwhelmingly happy with their operation. However, because surgery is not an exact science and we can't sort of predict or control every parameter in that healing phase, there's always a very small, tiny chance that things don't go according to plan and that the outcome is not quite what they expected. Of course, that's the point where we're going to be talking to the patient and discussing with them and see what it is that they're not happy about. And from my point of view, I'll always be as candid as I can, trying to explain to them what my thoughts are and whether I feel something more can be improved. And at the same time, if I think that the result is probably as good as it gets, and there's not much room there for surgery to make it much better, I'll be honest with them and tell them. But if, on the other hand, I think if I feel it's clearly not right and we agree that it's not right and things can be done to improve it, I certainly offer them a revision, and I don't charge for my services for that. And I usually cover patients up to 2 years post-operatively. So I think that's a bit of reassurance that many patients do appreciate and like.